Some surgeries require the use of a drain. The purpose of the drain is to create suction and help remove excess fluid produced by the body during the recovery phase. The drain will also help the body enclose any large open spaces created during surgery, which will help reduce the risk for seromas or fluid collections and infections. Drains are typically left in place for 1 to 3 weeks after surgery, depending on the type of surgery you had and how much fluid your body is producing. The drain is run through the surgical area and exits the body through a point in your incision. It is held in place by a suture. The drain tubing is attached to a bulb where the drainage will collect. The bulb should always remain compressed to ensure proper suction. If it is not compressed, it is no longer holding suction and the clinic team should be notified. The tubing should never be removed from the bulb and nothing should ever be put inside of the bulb. You will want to strip the tubing several times a day. Stripping the tubing helps move any clots and tissue in the tubing to prevent the drain from getting clogged. Before you strip the tubing, it is important to wash your hands. Then you will use one hand to stabilize the drain and the other hand to pinch the tubing and carefully pull towards the bulb. After stripping, you may notice that your tube temporarily deflates and it will regain its shape over time. While you are stripping, you want to make sure that you go all the way from the insertion site to the bulb. You will empty the bulb 3 to 4 times a day and record the amount of drainage each time. To empty the bulb, you will open the stopper on the top. Once the bulb is inflated, record the amount of drainage using the numbered markers on each bulb. You will empty the bulb contents directly into the toilet or sink, and you will squeeze the bulb to recompress it before closing the stopper. Drainage will initially look bloody and then over time it will slowly turn into a straw yellow color. If you have more than one drain, it is important to measure and record the drainage of each separately. When given approval for showering, you may do so with your drain or drains. Before entering the shower, ensure that the stopper is closed and secure your drain around your neck using a lanyard or a shoestring to avoid any accidental pulling. You may have some leaking at or around your insertion site. You can apply gauze as needed around the drain to help prevent the drainage from getting on your garment or your clothes. To help ensure the best fit, you may use some clean scissors to cut a slit in your gauze and slip it around your drain at the insertion site. This can then be held in place with a piece of clean paper tape. The gauze should be changed once saturated to keep the area clean and dry. It is normal for the area to get red and irritated, which will resolve once the drain is removed. However, if the redness spreads just beyond the drain or becomes very painful, or you experience fever, chills, or any changes in your drainage, please give the clinic team a call, as this could be a sign of an early infection.